Today we'll be addressing a sensitive topic, and one that men are oftentimes afraid to talk about. That is erectile dysfunction, which is actually a very common condition. Today we'll be bringing a urologist who is an expert in men's sexual health, and we'll be addressing a very viable and satisfactory option for men when more conservative options are no longer working. So stay tuned. Well, I really want to thank our loyal listeners for continuing to follow the Prostate Health Podcast. It is truly an honor to have so many amazing guests, and you continue to embrace them all. Thank you again for being on this journey with me. This will be our last episode of Season 2. While there will be a brief period of downtime for the podcast, August will still be an exciting month. Our doors are now open with the launch of the Prostate Health Academy, and we'll be spending a lot of time getting to know our new members of the Academy and working hard to help them succeed along their prostate journeys. On a personal note, I'm also excited that August marks the upcoming arrival of our third child, so I will also be taking some time to spend with the family as well. We are looking to be back, though, with new episodes for the podcast in September, so definitely stay tuned as we will continue to deliver for our listeners when we open back up for Season 3. The show today is brought to you by our sponsor, the Prostate Health Academy. The Academy is an essential community for individuals wanting to learn more about prostate conditions, connect with like-minded individuals, and improve their overall health. We just granted early Academy access to those on our waitlist. Well, in case you missed the opportunity, for our loyal listeners of the podcast, we've also decided to grant early access to our podcast listeners before our big launch. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We will see you on the inside. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. It is an honor to have on the show today Dr. Dean Knoll. He is a board-certified urologist currently practicing at Urology Associates PC in Nashville, Tennessee. He completed his residency in urology at the Mayo Clinic in Rochester, Minnesota. He is a frequent contributor to the medical press. Dr. Knoll has published over 100 peer-reviewed articles, abstracts, and book chapters. He has delivered numerous lectures and operated both nationally and internationally. Dr. Knoll has been a principal investigator in over 110 basic science and clinical trials of new devices and pharmacotherapies for various urology conditions, including new devices and pharmacotherapies for the diagnosis and treatment of male erectile dysfunction, male and female urinary incontinence, and benign prostatic hypertrophy. To date, he is recognized as one of the leading penile prosthetic surgeons in the world. Dr. Knoll, welcome to the Prostate Health Podcast.
Thank you. I appreciate the opportunity to be invited and involved with this particular podcast this evening.
Well, Dr. Knoll, many of our listeners are familiar with erectile dysfunction as a potential side effect of treatments for various prostate conditions, prostate cancer in particular. But can you explain some of the other more common causes of erectile dysfunction?
Sure. There's a large number of people, as we know, who will experience some degree of erectile dysfunction. For example, as we know, there's a famous study, the Massachusetts male aging study, that says between age 40 and 75, 50% of males will experience some form of erectile dysfunction. There are many causes for erectile dysfunction, not only the management of prostate cancer conditions by various treatment options that the patient may select for his prostate cancer therapy, but certainly it's anything that involves the vascular tree, which brings in the blood supply to the erection bodies, as well as the neurological input that creates an erection. So anything that interferes with the blood flow in, for example, when a male gets an erection, that's a good quality erection through only a 2 millimeter size artery, well, they have an 8 to 10 times increase of blood flow. So it's a very significant vascular increase that has to be stimulated by a neurological input that will allow the erection to occur. And so anything, for example, anyone who has significant cardiovascular disease or patients who have hardening of the arteries or atherosclerosis, narrowing of the arteries with aging, that occurs anywhere in the pelvic area, etc., can contribute to blood flow changes. And then, of course, any neurologic condition, spinal cord injury patients, patients who develop other neurological conditions can have erectile dysfunction occur.
So for this episode, I know that we're going to be focusing on one particular option for men with erectile dysfunction when conservative options are no longer working. But before we get into that, I thought it would be helpful to just briefly review what are the conservative options for erectile dysfunction and how do they work?
Sure. When a patient who has significant cardiovascular disease or, a very, very common culprit of erectile changes is the diabetic patient. And anything, again, that interferes with the normal function of the blood flow, smooth muscle relaxation that occurs to obtain and maintain an erection, as well as the initiation of this process, can be managed in several ways. When I first was dealing with this, and I've been dealing with urology for over 3 decades, so we won't go back to that, but basically what it is the first line of attack that we all tend to try to administer to our patients is the use of oral therapy. And these drugs we're all familiar with, the Viagra, the Cialis, the Levitra. These are oral medications that may allow someone to gain improved blood flow, improved ability to obtain and maintain an erection. So that generally is the first line of attack for our patients that we would administer. Patients are on organic nitrates because they have coronary artery disease, then that's the contraindication where you couldn't use an oral medication. But the oral medications are usually tried, usually by primary care physicians, by urologists, by endocrinologists, cardiologists, anyone who's dealing with someone who has that. The first line of attack would be to look at the use of oral medication. But 35% of the people don't obtain a good result from the use of these oral medications. So at that time, there's 3 other treatment options that we will offer our patients. One is injection therapy, where the patient takes a thin diabetic needle, injects a medication into his penis, and 10, 15 minutes later, he'll obtain an erection that allows him satisfactory intercourse. There's another potential treatment option, which would be a penile vacuum device, where basically a chamber is placed over the penis. There's a vacuum created, which pulls blood into the erection bodies. And there's a trapping band that is placed around the base of the penis, and that can allow patients to have intercourse. And then, of course, there's one other definitive treatment option that can be offered to patients, and that's the implantation of a penile prosthesis, which has been around for over 50 years now.
Well, what are some of the different penile prosthesis available on the market for patients?
There are basically 3 types of penile implants that a patient may wish to select if they go to the point where no other therapy has been effective. The medications, oral medications don't work. The injections don't work. The vacuum therapy is not adequate for them. Then those patients have the opportunity to select a penile implant as a very definitive treatment option. There are 3 different types of penile implants. There's a malleable penile prosthesis, which basically is a silicone rod with some type of metal component to give rigidity interiorly, and that's implanted, and the patient will have the ability to have good rigidity, but the flaccidity or the ability to conceal the prosthesis, they will bend it. So that's a malleable penile implant. There are 2 types of inflatable penile implants that are available for patients. One of these implants is a 2-piece implant where there's inflatable cylinders with a pump reservoir that gets placed into the scrotal area. And so they will inflate it and they can deflate the device. And then the three-piece penile implant is the penile implant that is most utilized in our country. And that consists of two cylinders that get placed into two erection bodies. There's a pump that gets placed inside the scrotum. And there's a reservoir of fluid that's hidden in the lower abdomen. And all of this is totally concealed within the patient. In this type of penile implant, when the penis is not, they don't want rigidity, it's very flaccid because the fluid sits in the reservoir. And then when the patient wants to obtain an erection, they will then take the pump through the scrotal skin, which they'll palpate, they'll feel it, and then they'll squeeze the pump and the fluid will transfer from the reservoir into the cylinders, and the penis then becomes very erect. And then those patients have sexual activity. And then there's a device, a deflate component to the pump that's in the scrotum. They will squeeze this in, and then the fluid will leave the cylinders and go back into the reservoir, and the penis then becomes flaccid.
Well, we're going to take a quick break with a word from our sponsor, and we'll be right back. The Prostate Health Academy is an essential community for individuals wanting to dive in even deeper and learn more about the latest technology and treatments available to them for prostate conditions. In the Academy, you'll be able to interact with like-minded individuals in the private community forum and have access to exclusive bonus podcast member-only video content, experts, innovators, and leaders in the field. We'll also be keeping up with the latest evidence on prostate-healthy diet and activity and creating a roadmap to keep you on track. We just granted early Academy access to those on our waitlist. Well, in case you missed the opportunity, for our loyal listeners of the podcast, we've decided to also grant early access to our podcast listeners before our big launch. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Again, that is www.prostatehealthacademy.com and click on Join Now. We'll see you on the inside. Well, certainly an excellent explanation there, and I appreciate that. And so I thought next we could just briefly cover kind of more of the technical portion of the procedure in terms of, how you counsel your patients. I'm sure a lot of your patients, first of all, want to know what's involved with this type of a procedure and maybe how long does it take?
Sure. And I think, Garrett, that's a very, very important part of counseling the patients and educating the patients to allow them to have adequate information so they can select the type of penile prosthesis that they wish. For the malleable prosthesis, the patients that may be better suited for these are patients that have significant deformity to their hands, where they would have difficulty inflating and deflating a pump mechanism. So patients who have severe Parkinson's, patients who have MS, multiple sclerosis, where they lose the strength in their hands. And sometimes patients have significant arthritis that doesn't allow them the ability to utilize a pump for inflation and deflation. So those patients may be better suited for a malleable implant. The malleable implant can be put in a couple of approaches. You can make an incision behind the head of the penis. You will dilate or make a space to put the device into the two erection bodies. Every male has two erection bodies. And then there's another approach where you can go through an incision between the scrotum and the shaft of the penis. Then if patients don't want to have a malleable device, then you can educate them on the advantages and disadvantages of the two inflatable devices. But 95 to 97% of the inflatable devices put in are patients who select a three-piece because it gives the best rigidity and it gives the best flaccidity or concealment of their penile implant. Again, for the three-piece device, there's two surgical approaches. One of the approaches can be an incision made into the scrotum. These cylinders are placed. The pump is placed in the scrotum. And then the reservoir of fluid is placed up through one of the cord rings that go to our testicles to go and place the reservoir in a different location that's not palpable in the scrotal or abdominal area. And the same holds true. There's another additional approach for the three-piece device where you can make an incision at the base of the penis and the lower abdomen. And then all three components, the two cylinders, the reservoir, and the pump are then placed through that small incision. These are 95+% of these procedures are done as outpatients. The patient does require some general anesthesia. For certainly the 3-piece and the 2-piece inflatable device, we utilize that. Or sometimes they'll get a spinal anesthetic. And then, of course, once the patient heals up, which is at 6 weeks, we then allow these patients to resume normal sexual activity. Some physicians are allowing patients at 4 weeks. I always tell my patients for the first week, though, there is some discomfort, but this is easily managed with over-the-counter medicines as well as or pain medication if needed. And then for a week, I restrict their activities, and then they can do anything they wish except heavy lifting for 3 weeks, and then no sexual activity for that 6-week time period.
Well, thank you for that. And, I think another question that I think a lot of men have, is this something that's typically covered by insurance?
Well, that's a very good question. Certainly, that is something that all of the offices will go and get pre-certification for. And the majority of patients, certainly all Medicare patients, are covered for a penile implant. And the majority, I would say 80% of the commercial carriers will also cover the penile implant. And again, it's because of a medical condition, diabetes, prostate cancer therapy, that type of thing has created this organic process.
Now, also when counseling your patients, what are some of the risks that you'll describe to them that, to be aware of prior to undergoing the penile prosthesis?
Yeah, what I always make sure is most important that patients don't have unrealistic expectations. And these unrealistic expectations can be learned from various pieces of information on the internet now. But certainly I always tell the patient, when you develop your erection change, the smooth muscle that used to expand in the erection body becomes replaced with some scarring, collagen. So when the penis doesn't function like it used to, 100%, that smooth muscle inside the erection bodies is replaced with collagen, and collagen is scar. And so basically what it'll do is it will contract the penis. So patients will never have their pre-ED, if you will, erection changes penile length. And I always tell patients that length is not going to be like when you were 18 years old. So they have to understand they'll have very good function when they want it, as long as they wish. And it's important for them just to realize that the length that they had before they developed erection changes is not going to return. And that's the most important thing, because that's the most dissatisfying thing for these patients if they're not told that piece of information. Yeah. The other thing I tell the patients is once it's implanted, the patient really doesn't know they have a penile implant. It's no different to have a knee, a hip, or a heart valve. That just becomes part of their body. I also tell patients if they stood there with their clothes off, no one would really know they had a penile implant inside them. And I also tell them physically what they do before a penile implant, they're going to do after a penile implant. So if they jump out of airplanes and ride horses, that's what they're going to do after they have their penile implant. So that's important to share that piece of information with them as well. The other educational process that's important is them to realize that they'll have normal sensation, orgasm, and ejaculation, the sense of it. If they've not had their prostate removed, they still will have fluid emit when they have an orgasm. Of course, once they get their prostate removed, the emission or the fluid is no longer released because of the surgery to cure their prostate cancer. So I tell them they'll have normal sexual function, sensation, orgasm, the sense of ejaculation. And I also tell them their partner really wouldn't know that that wasn't their God-given erection before they develop their erection changes. And the reason is because they have an erection when they want it. They have it as long as they want it. And when they don't want an erection, they don't have it. So those are the things that I tell them. And then there's two additional things that I also tell them. There's always a chance of infection. This is a foreign body being implanted into a patient. So if it gets infected, it had to be removed and another one replaced. But due to surgical techniques being better than 50 years ago, 40 years ago, and also the use of antibiotics Our technique with our implantation is better. So the risk of infection has been decreased to less than 1% to 2%, which is the lowest infection rate of any implant put into a human, whether it's orthopedic, cardiac, dental, plastics. So that is a potential complication that I will discuss with them. And then the last thing is mechanical reliability. If the patient has an inflatable device, it's in a hydraulic system. And so with time, it may malfunction. The fluid, if it did leak, is saline, so the body absorbs it with no consequence, and it would have to be replaced. But that's improved over the years as well. And now, within 10 years, probably 8 to 10% of them may need to be replaced. But those are the things that I would discuss with them. Their length won't be the same as it was before erection changes. Their sexual function will be intact. Physical activity is not changed. And then, of course, the possibility of a low risk of infection and a lower risk of mechanical failure.
Well, just an excellent review today from our guest expert in discussing penile prosthesis as a viable option for men when conservative options are no longer working. Dr. Knoll, any final thoughts today for our listeners?
I think the most important thing for someone who experiences erection changes, whether it's due to diabetes, prostate cancer removal, prostate cancer therapy with radiation, etc., whatever the cause of it is, and there are multiple causes, but there always is a way to make the patient whole. And if the conservative measures, if you will, with oral medicines, a vacuum device, and injection therapy don't work, penile implants carry the highest patient and partner satisfaction rate of any treatment option for erection changes.
Well, it's really been a pleasure having the opportunity to chat with you today. I think this information will be very valuable for our listeners. We greatly appreciate you sharing your time and knowledge with us. Thanks again.
Well, listen, I appreciate, Garrett, the opportunity to be on your prostate health podcast.
Thanks again.
Yeah.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/prostate health podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.